I'm Richard, and from biomedical editor from GeneOnline. First, I would like to ask: is this your first time attending the Taiwan Healthcare Expo?
Yes, this is the first time I attend the Healthcare Expo.
What's your impression or feeling about Taiwan's healthcare system? What's the advantage regionally, or what kind of characteristics that maybe Singapore can learn from Taiwan's experience, or from Singapore's perspective, what kind of professional qualities that can help Taiwan's healthcare system to develop?
Okay, I think we should recognize that in this world now, in terms of the health system, and if you look at the Bloomberg Healthcare Efficiency Index, you will see that the four most efficient countries in the world are Singapore, Hong Kong, Korea, Taiwan. So we in Asia, we are providing high quality healthcare. I think that's something that we as Asians should be proud about, but it also means that we likely have very similar challenges in terms of constraints, the type of disease burden. All four of these countries are super aging societies. Taiwan has a very, very, very good health system. I think legal coverage is 100%, right, within your country. What I find very impressive about Taiwanese health system is how rapidly and how quickly you innovate to change. And I think one key ingredient is the very, very close link between health care institution and industry partners. So you have that very close link, and the entire value chain from inception of ideas, validating it on the ground, field testing, implementations, to protocol, to manufacturing at scale. I think you have it all in that whole system.
And the next question will be about the Singapore General Hospital. Can you share some of the successful experience from the SGH and how these innovation and success stories can inspire a healthcare system in regional or even global aspects?
This recognition, while they are very positive, it is also true that it is not something you should take for granted. That the entire ecosystem of adopting this technology and implementing them on ground and then scaling them, it doesn't happen by accident. Changes are very stressful, and health system as it is now are already under a lot of stress. It means that you have to adopt and adapt a solution quicker than ever. If not done properly, it can have the opposite effect. I see the ability to learn, adapt, implement almost even more important than the ability to innovate. Because if you innovate and you cannot scale, then you'll just be in the valley of death.
To my understanding, some of the global public health challenge includes like non-communicable disease like cancer, diabetes, and the growing burden of healthcare professionals, as well as the skyrocketing costs. And from your point of view, how the healthcare innovations can help to alleviate these burdens, to cope with these challenges?
I would look at these mega challenges as common challenges that all healthcare institutions in the world are facing.
Yes.
And which also likely mean that we are all trying to find similar solutions. They are interlinked and interrelated. Your chronic disease burden will increase. With higher disease burden, your healthcare costs will increase. Each can contribute and make the other worse. How do we reduce the prevalence of disease? That means keeping people healthy. And if they are sick, try to intervene early. we are pushing what we call a Healthier SG strategy, which is centered around enabling our own population look after their own health, work closely with their GPs, and we do a lot of what we call social prescription. You prescribe social activities like dancing and cooking classes and stuff like that that promote both physical and mental well-being. So you want to keep your population healthy in the community for as long as possible.
And one last question would be about the vision of future health in Singapore.
Sure. I think what we really want to do is to build what I would call a phygital hospital. So your building must work for your digital innovation. An example would be your corridor must accommodate robots, right? So it's building a physical structure that works for a digital first approach. And in so doing, we would have an opportunity to create what I would call a borderless hospital. What we need now is to build a hospital that truly is without wall, that the care can be extended into the community, your influence can extend into the community, and care, the best care, can be provided in the comfort of the patient's home without compromising the quality.
Thank you very much.
Thank you very much.